Welcome to Victim to Victory, the authority in personal injury. Today, we have an incredible guest here. We have Dr. Didier Demesmin. He's a pain management doctor. He's been a top doctor in New Jersey, voted for the last 15 years. He's also recognized around the world as the #1 pain management doctor in the world. It's a pleasure to have you here, Doc. Thank you for coming on board.
Thank you so much. Much appreciated.
Well, tell us a little bit about, we're going to dive right in. Tell us about the guidelines you set for the minimally invasive spine surgeries and therapy. Tell us a little bit about what that is and how you were involved.
Sure. So I do a lot of what we call minimally invasive spine surgery. So there's a society called the American Society of Pain and Neuroscience, which is actually one of the most recognized pain management society. We have members from the U.S. and obviously throughout the world. And I'm in the process of writing the guidelines with other pain physician, but also with a lot of spine surgeon about endoscopically assisted surgical procedures. So spine surgery now is becoming a little bit smaller in a way, just because you still have your traditional spine surgeon that do open back surgery, but now the field is actually advancing where you can actually achieve similar results as when you do an open spine surgery, but you do it minimally invasively. So there's not a lot of guidelines that were written prior, but our society, just because we know that it's actually like it's a big advancement. So now we're in the process of writing the guidelines. So myself and other physicians were the lead authors of the guidelines, and we've invited a lot of other pain management docs that do a lot of the procedures, and also spine surgeon as well, to be part of the guidelines. It should be coming out hopefully by July, August.
No, that's great. Well, just explain to our audience a little bit about the differences between an open back surgery, the old type of fusions and all the cutting and all the screws and plates
Sure.
that would go in, as compared to minimally invasive, especially in the recovery time.
Yes. So the analogy that I like to use is similar to when you see a cardiologist, for example. In the past, if you had a problem with your heart, you go see a cardiac surgeon, and you get your chest open up, and then if they have replaced a valve, the cardiothoracic surgeon would do that. Of course, there would be a lot of morbidity, just because you have they open the chest, you have to go on the heart lung machine, and then there's a lot of complication that can occur postoperatively. Now you can have an interventional cardiologist that can actually do a valve replacement through the groin by using one of the vessels through the groin.
Right.
And the same thing also, if you have a problem with your brain, like an aneurysm. Before, you had to get a craniotomy to get the vessel fixed, but now an interventional radiologist can actually go through with a wire going directly through the groin to the vessel, so actually put a coil to help restore it. So all these advancements are being done also in the field of interventional pain management, where if you need to get a surgical procedure done, of course, the surgeons are still there to do what they normally do, but if the case can be solved minimally invasively, we have all the tools and the technology to be able to do that now. Like, you have self-driving cars, you have self-driving a lot of different things. Just like advancement is being made throughout in everything that's being done, that we're using as humans, the same innovations are being done in medicine as well, where we can actually do surgical procedures minimally invasively. So the importance is the morbidity reduces, so meaning that there's going to be less complication, and also the patient can return to work faster. Sometimes a patient can go back to work within a week after doing a big minimally invasive procedure, as opposed to a 6-month recovery,
Right.
like you would do if you're going to be doing it openly.
Yeah, that's what's incredible is about the old lumbar fusions or low back fusions would take 6 months recovery and then a year before you felt normal again, completely healed. And now you can go back to work in a week. And
Absolutely. And this is not to negate. I mean, there's still some cases that still require the big open surgery, but what I do, what my group does, we'll look at the pathology, we'll look at the patient's physical examination, we'll look at the MRI, and we're like, okay, this can potentially be fixed doing something small as opposed to something bigger. And the good part is, in case a patient gets, for example, 50% relief after doing something small, they can always go bigger.
Right.
You can never go smaller, but you can always go bigger if you need to.
Well, you're a pioneer in the minimally invasive procedures. At University Pain, you're also involved in sports medicine,
Yes,
and you're involved at St. Peter's Hospital in New Brunswick, so I'm sure you get a lot of work from the colleges right there.
sure.
And now, what's the difference in treatment of a degenerative condition that you would find in somebody who's just worn out over time, an age-related condition, and one related to trauma, whether it's from a sporting event or whether it's from an automobile collision, slip and fall, or some sort of other trauma?
Yeah, so when I'm treating a patient that has a chronic condition from an age-related issue, it's usually not just the disc itself. There's usually pathologies on the bone itself, on the vertebrae. So meaning that when the disc doesn't work properly for a long period of time, eventually the vertebral body gets what they call modic changes, where you start having the nerve within the bone itself starts to deteriorate in the bone itself.
Right.
In addition to that, you're going to have what they call a lot of osteophyte formation or a lot of bone spur and stenosis, bony stenosis. So that means that you have to use something a little bit different. If it's like a sports injury or like an acute injury, like a car accident, the disc is usually still softer. The herniation is softer, not calcified. So you can use a lot of minimally invasive discectomy techniques to fix it. If it's actually something that's been there for a long period of time, you have to treat the vertebral body, the bone itself. So there's procedures we do called BVN, ablation, basovertebral nerve ablation, where we can actually go directly into vertebral body to the bone itself and do an ablation of the bone. In addition to that, we do what we call foraminotomies, where we can actually try to shave off some of the bone to to help fix the whole contour. If it's an acute injury like a sports or a car accident, the disc is still fresh, meaning that it's a soft herniation, meaning that the herniation is actually out, but there's not a lot of calcifications around it. There's not a lot of bone deterioration around it. So you can actually use like discectomy procedures and minimally invasive fusion to fix it without looking at what we call the BVN ablation, like ablating the bone itself.
Right. So you're doing a lot of lecturing around the world.
Yes.
Just tell us a little bit about where you've been, what you're talking about, and why the hell are they inviting you to go speak all around the world?
Yeah,
Tell us about that.
yeah, that's something that I enjoy so much. I mean, I've been so far this year, I've been to Vietnam. I was invited to teach to do a lecture on endoscopically assisted rhizotomy. Right after Vietnam, I
Well, tell
went.
tell the audience first what a rhizotomy
Okay,
is.
so essentially, so what a rhizotomy is, so if a patient has a problem with what we call the facet joint, which is a joint of the lumbar spine, there's a nerve that feeds the joint called the medial branch nerve. So when you do an endoscopic rhizotomy, what you're doing, it's a surgical procedure where you make an incision, you visualize the nerve with endoscopic guidance, and you can actually use a bovie to actually sever the nerve, to actually disconnect the nerve from the joint to prevent the patient from having pain. So it's a very innovative procedure, and I do a lot of that procedure. And I was invited actually in Vietnam, which is actually part of an endoscopic society conference, international conference, to speak about the procedure. From there, I went to Korea and I worked with a lot of the world famous surgeons. So, the one thing with Korea, they're very advanced in endoscopic surgery. I always say like Brazilians play soccer, Koreans do endoscopic surgery because they've been pioneering for a long period of time. Of course, we're catching up in the U.S. and other parts of the world, but Korea is still the standard of endoscopic surgery. So I went there and I was able to participate and to see one of the two most famous surgeons in Korea do surgical procedures in the cervical lumbar spine, which was very amazing. I recently went to San Francisco. Also, I was doing like a lecture again on orthobiologic, which is actually regenerative medicine. I'm going to be going to Croatia next week. After Croatia, I'm going to be going to London and also South America, Sao Paulo, Brazil.
Hmm.
So I've been doing a lot of lecturing throughout the world actually, and they invite me because because I'm a clinical assistant professor at Rutgers at Robert Wood Johnson. I write chapters in textbook. I do a lot of publications. So I'm a world expert in that procedure because I've been doing it for 20 years now. And I've adopted minimally invasive surgery for like 20 years. So a lot of time people adopt it later in their career. But since day one, I'm like, I train in a good program. I'm like, this is what I want to do. So I adopted the technology early and I started doing like a lot of clinical research. I studied a pain fellowship at JFK where I help write chapters in textbook, et cetera, et cetera. So I have like a, even though I'm in private practice, but I also do have like an academic twist to what I'm doing. So I enjoy it and I enjoy being invited to beautiful places to do the lectures.
which are great. And you also get to learn from some of the greatest surgeons around.
Absolutely.
It's incredible. So you're mentioning about regenerative medicine. Talk to us. That's the forefront now.
Absolutely.
And a lot of regenerative techniques are being used. Talk to us a little bit about, because we all hear about the PRP injections and different things. Talk to us a little bit about where are we now on the forefront of regenerative therapies and technology.
Yes, so regenerative medicine is actually it's the field where we also call it orthobiologics, where we use the patient's own cells to help regenerate some areas. So PRP stands for platelet-rich plasma. The difference with that, with the PRP, you have all your growth factors, you get inflammatory processes, etc. However, you don't have any stem cells. When you're looking at BMAC, which stands for bone marrow derived tissue, where you can actually get, you have to do a bone marrow aspiration to get the stem cells. It works a little bit differently than PRP because you're actually gonna be isolating stem cells directly to inject into the knees, into the shoulder, or even into the disc itself as well. Now, there's a lot of things. For example, there's something we call a Viodisc, which is actually like a synthetic, actually not a synthetic, it's actually donated nucleus pulposus, which is actually the actual the nucleus that you get from patients that were healthy patients donate those nucleus. It gets grown in a lab. You can actually re-inject it into a disc to help the disc regenerate.
Wow.
So very, very innovative things. And I think there's going to be a lot more things being done in the regenerative process. Like you said, it's the future. Patients can actually get relief without having big operations. So that's the whole goal of medicine going forward.
Well, while you're lecturing all over the country, do you ever have time now to practice medicine?
Yes, actually I do. So what I typically do, so I work for 5 to 6 weeks very, very hard, like literally from 6 a.m. until like 8 p.m. And then when I travel, it's usually for about a week at a time. So a week every 6 or 7 weeks. But I also have amazing doctors in my practice that are very good as well. But usually I'll work for like 6 or 7 weeks and then I'll go to a lecture for about a week. But when I'm traveling, I do learn a lot of also what's going on. And then I come back, work for another 7 to 8 weeks. And sometimes if I have to get invited to another conference, I'll go for like 4 to 5 days. But the good thing is, in my practice, we have two other physicians in my practice that are very, very good, very smart, board certified doctors as well, where they actually can help cover, like, see a lot of the patients. But I'm still like the lead person
Right.
that's still there. But it's like, but I love doing it because the good thing is, you not only I enjoy teaching, but you learn so much. I mean, recently, as a matter of fact, this weekend I was in Los Angeles for a conference called WCMIST, which is the World Conference in Minimally Invasive Spine Surgery. Doctors from Korea, from Cambodia, from all over the world were lecturing about minimally invasive spine surgery. I'm like, literally, I learned so much. I'm usually like a captive person. I mean, I'll wake up at 6 a.m. to make sure I'm on the front seat of the lecture to make sure I don't miss anything at all, just because you learn so much. Because the whole thing about learning how to be about these things, like, how do we treat patients better? Because it's my field. It's not. I'm gonna make a better shoe just because it's nicer. I'm actually learning to make people better. So the more I learn, the more my patients do better, and I take a lot of pride in that. I'm one of 12 doctors in my family, so I grew up with a lot of doctors. So I'm always like, since day one, I knew the importance of medicine. I know, like, when people were talking at my dining table about what my uncles were doing with their patients, I was always like, wow, you can actually make other humans better, and that's always been my goal. And the more I learn, the more I can actually make a fellow colleague better, and I take a lot of pride in that, and I love doing it.
What's incredible is that even though you're such a highly esteemed and highly rated pain management doctor, you're willing to go to various locations to increase your knowledge base. And that's probably because the field is evolving so quickly. It's almost
Absolutely.
like artificial intelligence. The field of medicine and the minimally invasive procedures, they're just evolving. So you're staying on top of the changes in minimally invasive
No,
procedures.
absolutely. I mean, to your point, is like it's the willingness to be able to do that because a lot of time, believe it or not, when I travel to those countries, sometimes like when I was in Vietnam, I was the only one from the U.S. You know what I
Right.
mean? I was in Korea, the only one person there. Again, because it's a lot of time, like you said, you have to take time away from your practice and you have to travel. I mean, I don't get paid for this.
Right.
I have to book a flight to go to Vietnam, book a hotel, and do a lot of these things, so there's a cost feature in it. But it's kind of like one of my favorite players, Kobe Bryant always says, like, he wakes up at 4 a.m. to practice. And the more you do that, when you're dedicated to your craft, you're going to be way ahead of everybody else. And that's what I want to do, to be at the forefront of everything that I'm doing.
Well, if somebody does want to find you, how do they find you, Doc?
Yeah, so
They're
you
not going to go to Cambodia to find you, are they?
absolutely not. So, I mean, one of my practices are throughout Jersey and New York. So, I'm actually in Somerset, New Jersey, University Pain and Spine Center in Somerset, New Jersey. But we also have locations in Monroe Township and also in Clark, also in Freehold, and different locations, and also in the city as well. But very accessible. I mean, like in usually I have like an amazing team. The one good thing is like the people that work in your office, a lot of them have been there forever. Like my PA has been there since day one. Actually, Sejal Patel, my PA, she started the practice with me, and I have like other PAs like Cece's been there for like 7 years. Like other people have been there for a long period of time. So we have a lot of good retention for good people. So you can always find me, and we can always accommodate everybody. So I'm always there. So like it's like a good receiver. So like I'm always open. Like even though I'm always like I'm never too busy. You can always come and see me.
Right. So just tell folks what is actually, everybody's heard of an orthopedic surgeon, a neurosurgeon, neurologist. Explain really what a pain management doctor and how you've gone well beyond just being a board certified pain management doctor into a top surgeon. So explain a little bit about how that evolved and what a pain management doctor is and your progression in that field.
Yeah, so a pain management doctor is a doctor that specializes on pain conditions, whether it's sports injury, cancer-related pain, like orthopedic injuries and car accidents, etc. So in the past, pain management was primarily in the past, maybe let's say like 30, 40 years ago, we only give medications. Like we're the guys giving the Percocets, we're the
Right.
guys doing just injection and trigger points. But as science is evolving, so a pain management doctor is actually more an interventional uh, doctor that practices to help patients using the smallest techniques to be able to help treat some conditions. So what I mean by that is, for example, like if you have a problem with a facet joint, instead of you can do what we call a radio frequency ablation, where you can actually burn the nerve to the facet joint. So we are what we would call an interventional orthopedist. I mean, I know that it's not the exact science, it's actually the exact term, but essentially what we're doing is minimally invasive orthopedic surgical procedures to help the patient get better, giving the patient an alternative. So, and and the field is actually advancing, and I think there's going to be a lot more innovation. But just like when I was in Vietnam, I met this one guy. He was a neurosurgeon from India, so he's doing a lot of artificial intelligence to incorporate AI
Mhm.
into surgical procedures, where you can actually look at looking at a bunch of MRIs, for example, looking at to see exactly what's the best to you can pick up like this various nuances, and also predicting based on the way the MRI looks, the body weight of the patient, et cetera, how long the surgery is going to take, and also what approaches to take. So there's a lot of things that are being done now where it's really, really exciting part to be like it's an exciting time to be in pain management, just because there's so many things being done again with regenerative medicine, orthobiologics, MIS surgical procedures, and everything else that's coming up.
Now, some of the things that you'll treat is chronic pain.
Yes.
I know sometimes if it's in the spine, you use a spinal cord stimulator. And there's also now a way to reprogram the brain with regard to pain. Please explain a little bit about that, how you're treating now people with chronic, unrelenting pain.
Yes. So spinal cord stimulator, like you described, it's what we call a pacemaker for pain. So just like in a, you can actually, if somebody has an extra heartbeat, like in a, because there's a nerve that's actually causing the heart to beat extra, use a pacemaker to help regulate it. So the same principles are also applied in pain management where you're pacing the nerve. The way you can think about it is the spinal cord is the highway that transmits pain signals from any part of the body to the brain. So it has to go from that part of the body that's injured, goes to the spinal cord, goes to the brain, and then we can actually have what they call pain interpretation. When you use a spinal cord stimulator, what you do, you are putting the lead directly over the spinal cord, over the highway where the signal travels to descramble the signal. So what you're doing is like instead of patient feeling pain, you are pacing the nerve itself to help reducing the pain intensity. They're also using it actually, just like you said, for to treat some brain issues as well. Just like in the past, people did ECT, electroconvulsive
Right.
therapy, like you were shocking the brain to achieve some kind of results. Now you don't have to go to doing something that's considered a little bit more not as fun of a process. You can actually use the lead directly as high as you can to the spinal cord. You can actually use also brain stimulators to help treat things like Parkinson's disease, epilepsy, chronic pain syndrome. Actually, I worked when I used to work. When I was at Robert Wood, I used to work with a very famous neurosurgeon where he did something called a cingulotomies, where you can actually just go and lesion part of the brain to help reduce pain, and the patient gets pain results immediately. Not only that, also change the patient's personality just because they get better pain control
Right.
and they get happier. Sometimes we're like,
Sure.
is that the same person? But there's a lot of all these advancements are being done, like spinal cord stimulation, peripheral nerve stimulators. There's a lot of other implantable devices that are being done to help reduce chronic pain as well.
Thank you, doctor. Is there anything else that there's so much in this in the field of pain management? Is there anything else you'd like to tell our audience about the way the field is changing and evolving?
Yeah, so and the biggest thing like we've been discussing is the all the minimally invasive ways. So when I say minimally invasive, we call it less invasive. So meaning that it's not to reduce the work that we're doing. It's still like, if I'm going to do a minimally invasive fusion, it's still a fusion surgery, but less invasive. So that way you reduce all the morbidity. You can actually achieve the same type of results by doing it on a smaller scale. So that's one of the biggest things being done. So there's a lot of things like orthobiologic, I think is huge.
Hmm.
We're using it not only in the disc now, you can actually help the disc regenerate. So if somebody has a degenerative process in the disc, like by living like a healthy long life, you can actually inject like a synthetic nucleus pulposus in there to actually help the disc regenerate and also regenerate the whole bone itself as well. So you can
Wow.
actually do so much. What I love about pain management, it's the fact that you actually get patients up and moving because some of us other colleagues like an internist, they can help fix the heart, fix the kidney, which is as equally important, but if you fix the heart, but your back pain doesn't prevent you from going and playing with your kids, you're going to have a great heart, which is amazing, but you're going to stay home.
Hmm.
What I love about my field is the fact that you can actually get people up, go back to work, pick up their kids. Like, you actually get people active in the process and you get people to travel. So that's what I enjoy about my field, being able to get people up and about. And I think it's amazing to be able to do that.
It is incredible. Even the new, you were showing me that tiny little cage you can now use for a fusion surgery, as well as the new disc replacements that are just attached to the upper and lower vertebrae without
Yes.
having to use a cage any longer. So some incredible advancements, and I'm glad you're out there at the forefront to help a
Yeah.
lot of the victims that are suffering from automobile collisions, as well as trip and falls, and people with chronic problems.
No, absolutely. I mean, it's my passion, as you can see, and that's my dedication to the world to be able to be the best that I can and to keep on advancing the field of medicine.
Uh, Ladies and gentlemen, Dr. Didier Demesmin, one of the top pain management doctors in the world. It's been our honor and pleasure to have him on the show. Thank you.
Thank you. Thank you for having me.